Hello, I'm Urologist Ömür Erdem Akkaya. Testosterone is one of the most important hormones in the body that make men a man. In its deficiency, muscle loss, an increase in fat, irritability, loss of sex drive, erectile dysfunction, and a decrease in energy can be seen. Does it cause just these? What happens in testosterone deficiency in terms of heart health? Looking at this, an increase in cardiovascular diseases and an increase in mortality due to cardiovascular diseases in patients with testosterone deficiency has been demonstrated in large studies. An increase in mortality due to cardiovascular diseases has been closely associated with testosterone deficiency, especially in older age patients with testosterone deficiency. If we treat these patients with testosterone, will it cause trouble? There are different opinions about this. I would like to especially clarify this issue, because there are hundreds of studies on this subject. Hundreds of these studies say that when testosterone is given to patients with testosterone deficiency, there is a decrease in the rate of cardiovascular diseases and a decrease in death rates. So, is there a different opinion? If we look at different opinions, the FDA, in other words, the American Food and Drug Administration warned that if testosterone treatment is applied in testosterone deficiency, the risk of cardiovascular diseases and stroke will increase. There is a problem here. The FDA has done this based on 4 studies. In one of these studies, the study has already been corrected, saying that incorrect data was given. The other 3 do not have high evidence value. There is a problem, though. The evidence value of hundreds of other studies is also not very high. In a statement on this subject, Mayo Clinic said that treatment in testosterone deficiency may have positive results for cardiovascular health. Frankly, nobody can speak for sure. Because, in order to be able to talk about this issue in medicine, studies with a budget of millions of dollars need to be done. And because testosterone is not a patented product or substance, because it is not owned by anyone, because nobody can own it, studies with a multi-million-dollar budget will never be done on testosterone. Therefore, it is not possible for us to see a study with a high level of evidence. But I can say that since the FDA was involved in many sensational events at the time, frankly, my opinion is that testosterone treatment may be useful in testosterone deficiency. Many studies support it in this way. It does not only reduce the death rate by reducing the risk of cardiovascular diseases. At the same time, hundreds of publications have been published in the last decade showing that testosterone improves ischemia in patients with heart ischemia, increases exercise capacity in patients with heart failure, and also reduces blood sugar levels and insulin resistance in patients with diabetes or latent diabetes. If we are going to start testosterone treatment, a treatment plan can be made for the patient in this perspective by explaining what he needs to know, the risks and benefits. This is my own opinion. Apart from that, if we talk about the situation regarding anabolics and heart health, obviously human studies on this subject are very limited. It's not ethical to do studies anyway. Decabalin, namely nandrolone, was especially evaluated in animal studies. Nandrolone makes the heart bigger than normal in animal studies. Normally athletes have heart enlargement already, but when you give nandrolone, namely decabalin, the heart gets even bigger. And it has been determined that there are areas that we call ischemic areas in the heart, and due to this impaired blood supply, there are permanently damaged areas in the heart. In addition, 19 cases of anabolic users who had sudden death were evaluated. The common feature of these 19 cases is that all of them are long-term anabolic users and have heart-related deaths, and all of these cases have been autopsied. In cardiac autopsy, areas without a blood supply, which we call ischemic areas, were detected. You can see it here in the photo. Here in the middle of the heart that we call the septum, there are white areas that do not have a blood supply and so do not work. As the amount of these areas increases, the rate of heart failure or heart-related death increases. Some of those people died suddenly while in bench press, some of them while training and some after the training. Also, anabolics have an effect of disrupting arrhythmia, which is heartbeat rhythm. As a result, anabolics create harmful effects, but this should also be said, there are over 4 million anabolic users in the United States alone, and there are perhaps 10 to 15 million chronic anabolic users in the world. So these 19 cases are actually very limited. I also have to say that it's so limiting to evaluate the patients according to this, that's what the publication says. But users of anabolics should also be aware that they are at cardiac risk. Because after all, you don't know the exact ingredients of the product. You do not know the exact amount of the product. There are many questions regarding the reliability of the product. You do not know exactly how the product will react in your blood or body. In other words, users help each other with the knowledge they have developed among themselves. Of course, they inevitably carry some risks. But as a result, anabolic users need to pay attention from a cardiac point of view. As a result, I can say that many publications have shown that testosterone treatment has many positive effects on the heart, although it is not certain. Many publications have stated that the decrease in the number of cardiovascular diseases, the decrease in the risk of death, the increase in exercise capacity in heart failure, and the positive effects on heart ischemia and diabetes will have positive effects in many cardiac patients. Thank you for listening, best regards.